How are rare osteosarcoma types like Parosteal discovered? Rare types of osteosarcoma, such as Parosteal osteosarcoma, are identified through a careful process that combines clinical evaluation, imaging studies, and histopathological examination. It often starts when a patient notices a painless, slowly growing mass near long bones, like the thigh or knee. This mass is typically firm and immobile. Because the symptoms can be subtle, early detection relies on a thorough clinical examination and a healthcare provider's suspicion of bone surface tumors. Imaging plays a crucial role in identifying and characterizing parosteal osteosarcoma. Initially, X-rays can reveal a dense bony mass that arises from the cortical surface of the bone. Sometimes, you may see a radiolucent line that separates the tumor from the cortex, which is an important detail. Computed tomography scans provide more detailed information about the tumor's extent and involvement with the bone. This imaging is particularly useful for planning any surgical interventions, although it may not always show if the tumor has invaded the bone marrow. Magnetic resonance imaging is another key tool. It excels at detecting early involvement of the bone marrow and any soft tissue extension. MRI can also help differentiate between tumor grades. Changes in the MRI signal can indicate the histologic grade of the tumor and help identify if there is any dedifferentiation, which means the tumor has progressed to a higher grade area. Once imaging suggests the presence of parosteal osteosarcoma, a biopsy is necessary to confirm the diagnosis. Under the microscope, parosteal osteosarcoma shows a biphasic pattern. This includes mature woven bone trabeculae and a spindle cell stroma that has low cellularity and low mitotic activity. If there is any high-grade component present, it indicates dedifferentiated parosteal osteosarcoma, which is associated with a worse prognosis. Molecular testing can also support the diagnosis. For instance, the amplification of the MDM2 gene is often found in parosteal osteosarcoma and helps differentiate it from other surface bone tumors. Diagnosing parosteal osteosarcoma can be tricky because it can resemble benign bone lesions, like osteochondromas. Therefore, it is essential to correlate clinical findings, radiologic results, and pathologic data. The combination of imaging and biopsy results allows for a reliable diagnosis. In summary, discovering rare osteosarcoma types like parosteal osteosarcoma involves a multidisciplinary approach. This includes clinical suspicion of a slow-growing mass, detailed imaging with X-rays, computed tomography, and magnetic resonance imaging to define the tumor's characteristics and extent, along with a confirmatory biopsy that includes histological and molecular analysis. Early and accurate diagnosis is vital for planning appropriate surgical treatment and improving patient outcomes. Always consult with healthcare professionals for personalized medical advice.